Hello, my name is Linda Van Horn, and I'm the founder of iShare Medical. The problem that we are solving is that medical records are incomplete. And when patients see multiple different providers in different care settings, none of whom have access to complete information, it becomes easier for things to go wrong. In fact, in a study published by Johns Hopkins University School of Medicine, they found that preventable medical errors are the third leading cause of death in the United States beyond heart disease and cancer. At iShare Medical, we are on a mission to innovate the future of healthcare by creating a complete medical record organized around the person that is easily shared and continuously updated so that it can be used to improve care and outcomes, reduce cost, and save lives. iShare Medical is ENAC accredited for HIPAA privacy and security and a Direct Trust accredited trust anchor. Our target markets are healthcare providers and health IT vendors that serve them. There are 6 million healthcare providers, about 1.1 million are physicians, and 6,120 are hospitals. Our platform is based upon 3 health IT pillars. Pillar number 1, digital identity. Health data is sensitive, and it can't be shared with just anyone. So we need to know who we're speaking with in order to establish trust. iShare Medical ID proofs patients, providers, payers, and devices, and creates a federated identity credential that is trusted by all Direct Trust accredited trust anchors. This digital identity is the foundation needed to aggregate medical records from many sources into a complete lifetime medical record organized around the person that can be easily shared. Pillar number 2, interoperability. Interoperability is the ability to seamlessly and bidirectionally share medical information regardless of care setting, provider, or EHR. Sharing medical records across organizational boundaries is the foundation needed to help providers to better coordinate care, improve care and outcomes, and reduce cost. Pillar number 3, automation. iShare Medical's platform is used by patients, providers, payers, and devices to securely send, receive, and update medical information in real time, integrating with the EHR to deliver data to the patient's chart inside the EHR, and making it available to providers as a part of their normal workflow. These 3 pillars, digital identity, interoperability, and automation, are the foundations needed for a better, more cost-effective, and efficient health system. Our customers are hospitals, physicians, health IT vendors, quit lines for quitting smoking, clinical trial companies, research centers, and patients. I'd like to share 2 customer success stories. They are both health IT vendors that use our product, iShare Medical Messaging API. The Forum team was working with a physician practice that had 6 physicians and 5 non-physician practitioners to automate their patient registration process. The practice found that they were getting more accurate and complete information because patients were no longer rushed in filling it out. They also liked the fact that the data elements were going directly into the EHR, saving the data entry staff 30 to 45 minutes of data entry time on each new patient. Having the insurance information in advance allowed them to troubleshoot any insurance information issues ahead of time, streamline the providers as well as staff. And the providers are now able to see 27 more new patients per month than they were seeing prior to implementing iShare Medical. Overall patient satisfaction and staff and provider satisfaction has increased dramatically. So in summary, practice was able to increase the number of new patients by 27 per month. That added an additional $57,115 in revenue to the practice and decreased the cost of staffing for entering the data by $7,475 for the net benefit of $64,590. I'd like to share with you their customer, Dr. Robert Wilson, who's the president of Covenant Care Practices, and I'd like to have you hear from Dr. Wilson in his own words.
The hardest part is how do you integrate that into a traditional workflow and get that information into and in front of a provider at the time they need it to impact a decision. This gave us an opportunity to integrate that directly into our EMR, goes right into the patient's chart, the ability to get the data real time and use it at the time you're seeing the patient is the most helpful data you'll ever get.
Yeah.
iShare Medical was named in Forbes as one of the 52 women-led startups driving the future of health tech and fintech. Our team is made up of seasoned health IT experts and led by me, a serial entrepreneur with previous successful healthcare exit. Our coaches are SaaS Growth Academy, Pipeline Entrepreneurs, and Startup Health. No one should die because their physician did not have access to complete medical records. Thank you.